infant death syndrome. This is the unexplained death of the apparently healthy infant, usually during the sleep in infants. This is the leading cause of the unexplained infant mortality, often termed crib death or the cot death. Risk factors like infant related risk factors, prematurity and the low birth weight, male sex, slightly higher incidence, recent respiratory infection, and the brainstem abnormalities like the impaired autonomic control of the breathing. For the environmental and the sleep related risk factors, prone on the side, sleeping position on the stomach, soft bedding, loose blankets or pillow in the crib, overheating, excess clothing, room too warm, co-sleeping, especially on the soft surface like a couch or bed, exposure to the tobacco smoke for the prenatal and the postnatal. And the last one is the maternal risk factor, young maternal age, smoking during the pregnancy, alcohol or the drug use during the pregnancy, poor prenatal care. For the pathophysiology, triple risk model, vulnerable infant, brainstem dysfunction affecting the breathing and the arousal, critical development period, higher risk between the 2 to 4 months, external stresses, prone sleeping, soft bedding and the smoke exposure. For the clinical features and the diagnosis, sudden unexpected death of an infant, no warning signs before the death, no identifiable cause after thorough investigation like autopsy, clinical history, death scene examination. For the differential diagnosis, must rule out other causes of the sudden death. Accidental suffocation, positional asphyxia, unsafe bedding. For the metabolic disorder, fatty acid oxidation disorder, cardiac arrhythmia, long QT syndrome, Brugada syndrome. For the non-accidental trauma, child abuse, shaken baby syndrome. Prevention. For those back to sleep, always place the baby on the back for sleeping. Firm sleep surface. Use a flat, firm crib mattresses with no soft bedding. Room sharing, not bed sharing. Keep the crib in the parents' room for first 6 months. Specify use at the bedtime. May reduce the risk mechanism unclear. Breastfeeding and avoid overheating. For don'ts, no prone or the side sleeping, no loose bedding, no co-sleeping. Avoid exposure to smoke, alcohol and drugs. Prognosis and the public health impact. Peak incidence is 2 to 4 months of age, rare after 6 months. Decline in SIDS rate due to the Back to Sleep campaign in 1994. SIDS. This is the unexplained death of an infant. The peak age is 2 to 4 months, rare after 6 months. Prone sleeping position. This is a major risk factor. Triple risk model is vulnerable infant, critical period, external stressor. Prevention is back to sleep. Firm sleep surface, no soft bedding, no co-sleeping. Protective factors like pacifier use, breastfeeding, room sharing, not bed sharing. Public health impact. Dramatic reduction in the SIDS after back to sleep campaign.